What about, I mean, one piece we haven't touched on, and to kind of, it feels like this bumps up against several industry trends in terms of obviously cost control and management and resourcing and staffing, right? We're in an environment where everyone's trying to bend the curve in the US on healthcare costs. And I imagine there's some upfront costs to get your data into a FHIR format, but then long-term it pays dividends in terms of the ongoing management. And then there's also especially in the IT space, the staff resourcing and constraint issue that's always ongoing, right? So I'd imagine too, this potentially can free up organizations to sort of reinvest those resources once they get up and running. Is there something there?
Oh, yes, definitely. So you kind of touched on it briefly there with like the technical stuff that you need to manage this, right? So coming back to what I mentioned before about it being a RESTful architecture using standards like JSON, you can now onboard your technical staff and have them be valuable to you from an interoperability and data exchange perspective, in my opinion, exponentially faster than you used to with HL7 v2. JSON, again, is a technology standard across the board. It's not specific to healthcare like v2 was. So ignoring some of the more domain-specific understandings that you want about like, oh, what's an ICD 9 or 10 code? What's a CPT or HCPCS code? To someone who understands JSON, they're already halfway there because you say code, they know exactly what it's going to be structured like within that. And FHIR very specifically points that out in a way that is very easy to understand. So not only does it allow for people to be a lot more like flexible and efficient with ramping up your IT stuff, it also means that talking with other IT staff and other organizations, you're not having to re-explain everything in that particular scenario. And again, I'm going to reiterate it again, because of the way the data structure works and the way that the API is structured, again, just that onboarding process and that ease of use across different systems is immensely helpful in reducing cost when it comes to seeing that value and when it comes to going live with those integrations.
Makes sense to me. I mean, obviously there's a lot of ground here to cover. We've scratched the surface a little bit, but hopefully after listening to the virtual health team here, you have a better understanding for why the FHIR transformation is happening, why it's important, and the impact that it can have on your organization. We are going to get back together again in the future and talk a little bit more about some of the solutions and opportunities to facilitate this FHIR data and to transform it into value for your organization. So stay tuned for our next Future of Care chat coming up soon.